Isolation from other professionals, an unequal burden on women and migrant workers, and a general lack of support has left the sector under immense pressure, exacerbated by the COVID-19 pandemic. We learn about exploitation in the workplace and what your rights are as a care worker, and how we can share experiences or seek advice to create a safer environment for those in the industry.
What is exploitation in general? So from a philosophical level, if we start, the whole setup of live-in care and the pay, even if it's the best paid live-in care setup, in many ways it's exploitation. So it depends on where we draw the line. Theoretically, I think it's fair to say that this job, as it is at the moment, is quite exploitative. Often people don't say that they feel that they are exploited. And also often people say that they know that they are exploited at the same time. Just talking about myself, I can't really sometimes decide, because there are pros and cons, so it's not that straightforward, I would say. Obviously, there is a lack of knowledge and understanding about rights, and many carers have a limited frame of reference, shaped by isolation and being a migrant. As I mentioned, there is a more systemic approach to this, as we can say that exploitation is the nature of this job, really. Also, from a policy aspect, how we draw the line in terms of exploitation. And I think it's an interesting theoretical question for both carers and researchers to define a framework in which we say that this would be the minimum which is not exploitative.
Immigration rules and pay are other factors that contribute towards exploitation in the care sector. Levels of pay are generally low, but there's the cost of surcharges and high immigration fees, as well as paying for regular visa renewals. Workers are much less likely to be in a trade union, another driver for the fragmented, solitary nature of working as an individual live-in carer. They're less likely to speak to other people, know what is bad practice, and who to go to for help.
We discuss among ourselves as carers all the time around this. Some people are more pessimistic about this and say that they don't know where to go, or they don't even feel that they have any place to go. Others say that, I'm a member of a union and I can speak up, or I choose the agency carefully and I only work with agencies. This is really the situation. So for many people who come from even more difficult backgrounds, it's an advantage already. So it's not exploitation. And so many of us don't even feel that we need to turn anywhere, because life is so nice compared to where we are from. And we didn't mention so far the gender perspective of the whole thing, where women are, socialized in a way that we are not supposed to speak up anyway, and we could just bear the burden.
I think often, if we think about it in the context of safeguarding, people don't realise they're in a safeguarding situation until it's pointed out to them, because it becomes normal, doesn't it? And I think there's a lot of general awareness raising that needs to be done to help both the employer and the employee and the carer to understand what is and isn't acceptable. And I think there's a duty upon local authorities to ensure that they know who is working in that living cared way. And if the supervision isn't being put in place either by the agency or another, or if it's a self-employed model, what's the role of the local authority in providing that safe space supervision for people?
As many workers come from different countries, how can the law help, and how do employment contracts work?
Because the contracts are outside the jurisdiction, you'd have to have an enforceability clause for the UK jurisdiction, which is really alarming. If there is anything that could be enforced in this jurisdiction, I think some of those clauses would fall foul of the Unfair Contract Terms Act of 1977. I think it's, what are you signing? The balance of power. There is legislative and common law authority to help victims in these circumstances. I'm appalled and thinking, oh my God, I wish I could see these contracts and, really get the employers by the scruff of the neck and say, you think you can get away with it, but actually you can't. We do not allow this in this country. But again, I'm not I think it would be interesting to seek the opinion of someone who really knew a lot about contracts and unfair contract terms and about overseas, contracts that are signed overseas, but effectively all the terms are over here. Is there anything you can do? You may need to go down the modern slavery route, perhaps, in order to get that, because then you've got the ECAT obligations, etc., to get the protection over here. But, it's a really interesting challenge to think about.
You may know someone who has been or is currently in an abusive or exploitative situation. They may have asked you to help them, or you may feel that you should seek help on their behalf. If you are unsure what to do or who to refer them to, you can call the Modern Slavery and Exploitation Helpline for further information on 08000 121 700 or visit their website modernslaveryhelpline.org. If a person is in immediate danger, you should tell them to call the emergency services on 999. Or if you have the person's consent to do so, you can call the police on their behalf on 999 or 101, the police non-emergency number. In some cases, the police may share information on irregular immigration status with immigration authorities. If the immigration status of the person that you wish to help is insecure, unknown, or the person is undocumented, please contact Flex or one of the relevant organisations shown on screen. If you wish to report abuse or exploitation in the workplace, you can ring the Gangmasters and Labour Abuse Authority on 0800 432 0804. Calls can be made anonymously and interpretation is available. Abuse can also be reported to the GLAA via email at intelligence@gla.gov.uk. If the person has questions about their rights at work, they can contact the Advisory, Conciliation and Arbitration Service, known as ACAS. Their helpline number is 0300 123 1100. Calls can be made anonymously and interpretation is available. There are a range of other organisations who can help them, including the Citizens Advice Bureau, the East European Resource Centre, the Roma Support Group, the Work Rights Centre, and the Latin American Women's Rights Service. If the person has been sexually exploited or is a victim of serious organised crime and they speak English, they can contact the UK Human Trafficking Centre on 0844 778 2406, or they can use the internet to find a nearby rape crisis centre.